be free from HIV? PrEP can help. When taken daily and with other preventative measures like using protection and regular testing, it can reduce your risk of getting HIV by over 90%. Love free from HIV with PrEP. Learn more at michigan.gov/HIV-STD.
Are you doing it? Getting busy? If you are, do it safe. Get yourself tested for HIV. It's safe, friendly, free, and it can save your life. Get tested week starts December 1st. So if you're doing it, do the right thing. Call 866-EXAM-HIV. That's 866-EXAM-HIV. HIV. Live with it. Get tested.
Most people think that depression is just sadness, but in reality, there are many factors that contribute to it. People feel hopeless, self-loathed, isolated, stressed, anxious, emotionless, and guilty. When people have depression, it inhibits them from functioning on a day-to-day basis. Depression is a real disorder. So the next time that you think someone with depression is overreacting, think again.
A little music for a minute. Happy day, everybody. Happy day. Hey, Lisa. Hi, Bruce. Okay, happy day. This is Positively Dee discussion. You have to remember that HIV still exists. You have to get tested. You have to use protection. You have to use protection because if you have contracted HIV, you can get on medication and you can live a better, healthier life. Today I have two awesome guests on. Our first guest is Dr. Blackstock, and she is recognized as a tough leader and influencer in the areas of HIV, health equality, equity, and racial justice. She is the founder and executive director of Health Justice, a consulting firm providing content expertise in HIV, sexual health, LGBTQ health, and racial equity to organizations, particularly those focused on public health and healthcare. She is a primary care and HIV doctor and researcher who recently served as an assistant commissioner for the New York City Health Department Bureau of HIV, where she led the city's response to ending the epidemic. She holds a degree from Harvard College, Harvard Medical Schools, and Yale Schools of Medicine, and is passionate about achieving health equity, particularly for those in marginalized communities. Next, we'll also have Reginald Austin. Reginald Austin is a thriver and has been living with HIV for 13 years and has many, many more years to go. For the past 3 years, Reggie has been diligently working in the public health sector with a focus on HIV. He currently serves as a linkage to care specialist at the Aliveness Project in Northwest Indiana, and serves in many organizations throughout the state of Indiana, such as BTAN, Indiana, and HIV modernization, the modernization movement. Reginald has recently taken a public platform as he starts speaking about the struggles that people living with HIV experiences, including his own journey. So I'm going to bring on both of my amazing guests, and I can't wait. I hope you guys can wait either. Hola, Brian. Hola. Hi, Dr. Blackstock.
Hello.
Glad to have you on.
Hi, Dee. Thank you so much for having me.
Thank you. Hi, Reggie. Glad to have you. Okay, we're going to dig right into it. My show used to last 2 hours, believe it or not, and it really did stretch out 2 hours. So I cut it down to 1 hour. We're going to do the best we can. If we go a little bit over, it's okay. So, I want to ask you guys these questions. So we know that Blacks are the highest rate of HIV diagnosis, but we also know that Blacks and people of color struggle with barriers that marginalized communities face. There is medical mistrust, access to care, and other barriers. So, Dr. Blackstock, let's talk about some of these barriers and hear what you have to say about this.
Well, thanks so much, Dee, for having me on. It's a pleasure to be with you this evening, and also to be on with Reginald Austin as well. As mentioned, I'm a HIV doctor, primary care doc, so I speak from that experience also as a public health advocate. So we know when we look, at the trends in HIV diagnoses, we see that Black people, Latino people continue to be disproportionately impacted. And even though we've had, these advances made in terms of HIV treatment and prevention with more potent regimens, we still see these health inequities that exist in terms of diagnoses and also along the continuum. And as you mentioned, some of those inequities are really driven by some large sort of policies, systems. So even things such as having lack of universal healthcare, of comprehensive healthcare in this country, puts everyone at risk for poor health, but particularly Black people, because we're more likely to have jobs because of various labor practices that are discriminatory, jobs that don't have health insurance. We're more likely to live in parts of the country, such as the South, that, for instance, didn't expand Medicaid under the Affordable Care Act. And so when people don't have, health insurance, for instance, they're less likely to go get tested for HIV. They're less likely to have access to PrEP, the once-a-day pill to prevent HIV infection. They're less likely to have access to treatment and to be able to engage in care. And so we know that a lot of these different structural factors or structural drivers, like lack of healthcare, like mass incarceration, poverty, all of those are drivers of these inequities that we see, where we see, Black people still being disproportionately likely to be diagnosed with HIV.
Yeah. I always ask myself, will it ever end? That's the question that I continue to ask myself, as if it will ever end. Will these barriers ever end? That's the big question a lot of us always have: is will they ever end?
I'm a bit somewhat heartened just by the uprisings that occurred this year, with obviously more attention to Black Lives Matter and more awareness of, in particular, the role of health inequities when we look at, the disproportionate impact on people of color and Black people in terms of COVID-19. And so I think, this has sort of recharged the conversation around these issues. But there's still, as you said, there's still so much work that needs to be done till we see, an end to these inequities, particularly with respect to HIV, which I think has some of the most glaring inequities when we look at new diagnoses in New York City. 90% of new diagnoses among cis and trans women are among Black and Latino women. When we look at diagnoses among cis and trans men, about 80% of diagnoses are among Black and Latino men, obviously same gender loving men being disproportionately impacted, trans women. So these are just, huge issues that we're grappling with, and we're trying to do the best that we can.
Yeah, thank you. Yeah, I think all of us are, as patient advocates, because we really are patient advocates. Reggie, so we know that you're in Indiana. And can you tell us that, what have you seen in your community when it comes to stigma, discrimination, HIV criminalization? I know that you started to work closely with Carrie Foot. So can you talk to us about some of those things that are going on? Can you hear me? Reggie?
Oh, it is just.
Yes, we can hear you. Yes.
Can you hear me now? Okay. So I was saying it really is sad. First, I have to have this discussion. I was originally diagnosed in Detroit, and then I moved to Chicago, and then over into Indiana. So I got a chance to experience 3 different areas, and the stigma is always the first, that biggest issue and hurdle that we struggling to get over, even when it comes down to trying to change some of the policies and laws regarding the criminalization. We have to dig a lot first and educate and try to get over that stigma hurdle. Here in Indiana, we are a little bit more, I'm going to say, conservative and a little slow when it comes to getting the information on how the rest of the world is moving and the new things that are out, and new journeys and things that are going on in the AIDS world and movement. I remember, it's sad, I just learned about U equals U maybe 2 years ago. And it's longer than that. But that's how behind we are a little bit. Yeah. So that's what we're dealing with here.
So they're a little behind in other things that other states deal with as far as HIV. Is that what you're saying?
But I am saying that, but I do believe a lot of it deals with the stigma. I've had a chance to talk to a lot of people and sit at some great tables, and a lot of people just are refusing to catch on and refusing to update their knowledge and level of education concerning HIV.
Yeah, I kind of feel like it's all in one group. It's a stigma and discrimination. If there wasn't discrimination, there wouldn't be any stigma. I always see it as one, stigma and discrimination as one. If we can't get rid of this discrimination, how are we going to get rid of the stigma? Discrimination has been around for many, many years. It's not going anywhere, and we all know this. But it's the sad part is it's us, people of color, Black folks, that have faced this for many years. And just like Dr. Blackstock was talking about, all this Black Lives Matter. And people here in the United States, a lot of people don't know what Black folks deal with because they're not the ones dealing with it. If we didn't have cell phones, no one would have known about all these different issues that are going on social media because people are now recording. a long time ago, there weren't any video. There weren't people walking around with phones. So can you imagine all the things that had went on with the police killings and different issues in other cities that we couldn't see? And now we can see it because everybody is recording it from their phones. So that's just something different in the world that we're dealing with now. You know, it's us fighting for the rights of people of color, fighting for the rights for the trans community, being left out all the time. So we just have to keep speaking up loudly and continue to speak up in order to get these things done that we need to have done. Now, I want to talk to you guys about U equals U. Now, in the post, I had put viral load does not equal value. And a lot of people don't know what that means. So when I say viral load does not equal value, I say that because a person living with HIV who is undetected, they are no better than someone who is not undetected. And we have to continue to let people know that. It's not shaming anyone. We have to continue to talk about U equals U because it is actually saving people's lives. It is getting people to get back into care who are out of care. Right. And ultimately, it's going to help us to get to end the transmissions of HIV or lower the transmissions of HIV. Now, both of you seem to talk about U equals. When we have physicians, we have ASOs that don't talk about it. There are advocates that don't talk about it. And there's health departments that do not talk about U equals U. So why do you guys feel the need to share U equals U at the point that we're, where you share it at? Dr. Blackstock.
Oh, yeah. So this is a big shout out to Bruce Richmond and Murray Penner, who I see are in the comments with the Prevention Access Campaign for really promoting this, evidence-based message of U equals U. I think about when I've shared this information with my patients in clinic and, again, many people, even though in New York City, over the years, a number of people still have not heard of this message, do not know about it. I just remember having a number of patients who, despite being on treatment and despite being virally suppressed for a long period of time, still were not able to have sort of full, pleasurable, fully realized sex lives with their partners. And we're having to, hold back, modify their behavior in a way that was really, unnecessary. And in many ways, really dehumanizing and causing folks to feel, again, like vectors of disease. And so it's so critical to share this very simple and straightforward but very powerful message, with so many of our patients who've had to deal with, internalized stigma. And then also for people who may be considering, who may be HIV negative, but may be considering an HIV positive partner, having this information and knowing what they need to do to keep themselves and their partner, healthy and safe. So I think it's been, when I was at the health department, actually last June, we had a citywide campaign to promote this message called Made Equal, which was so exciting to really see the images all over the place. And also, targeted issues around stigma around sexuality as well. But again, just so excited. Dimitri Daskalakis, who was assistant commissioner, but before I was in New York City, he, I believe, signed on in 2017 to the statement. And so we've just tried, in the last few years when I was in that position, to really disseminate and share very broadly with both providers, because providers can be a huge barrier, right? Like if they're not sharing this information, it's much harder for people to find out about it. And also just sharing it with the public as well. So yeah, just super excited to have this as a relatively, new development in the last few years, and to be able to provide a message of like a really positivity and encouragement, optimism for many people who are living with HIV and their loved ones.
So Dr. Blackstock, why do you think that because New York is doing well when it comes to U equals U, they really are. There's so many other states that are struggling with getting the message out there to people who are living with HIV. What do you think? What do you think the reason is why providers are not sharing it? Because you're sharing it. I have a physician that shares it.
Yeah.
You know, it's a struggle trying to figure out why a lot of providers are not sharing it.
Yeah, I think unfortunately, particularly healthcare providers, I think particularly physicians, I guess I'll speak for physicians, but tend to be like very concerned around sort of they tend to be very, I don't want to say risk averse, but tend to be very judgmental about certain behaviors and very prescriptive about what behaviors they believe people are okay and are not okay. A lot of it also has to do our medical school education. A lot of that has not been updated with the times. Like, I don't even know if in medical schools people are learning about U equals U. I don't know if maybe Bruce and Murray have information about that, if that information is being incorporated into medical school curriculum or residency training programs. But I think providers, medical providers, tend to be on the more conservative side and sort of a lot of times take this position like they're the ones who should be sort of like these judges of morality, and like, I think this person will be, should have this information. I think this person shouldn't have it. And I think there's concern. I think at the end of the day, there's concern that, what if by chance I share this information with someone and they're not undetectable and they pass on HIV to someone. I think that some providers are really concerned about that and like liability issues as well. But we have an abundance of data that shows that, once someone is virally suppressed and they're adhering to their medication, that they have really effectively no risk of passing on HIV to their sex partners. And it's just really important for just providers to know. And I think a lot of providers actually don't know this information. And so we just want to continue to provide education about it. I see Murray Penner saying that GW Med School is sharing this information with their med students, which is so important. It's all about the early generations and making sure they know this, and they're like little sponges, and that they share this with patients.
Nice. Reggie, how about you? Why do you feel the need to share U equals U in your community with your advocacy?
Well, U equals U. The moment I found out about that was when I became normal.
Wow.
That was when I felt normal. That was when I felt equal. And it's so sad. When I remember being at, I want to say it was United States Conference on AIDS, and I remember I think it was that one, but you were up on stage and you guys did like this powerful moment for U equals U.
Oh,
and,
yeah.
Yeah, I remember walking away from there changed, like forever. I have taken the role into preaching about U equals U because just as it finally brought me alive and it made me feel normal and finally a part of society, that's what I want to share with everyone else. And where I work, I do linkage to care. So I link those who are newly diagnosed, who need to get back into care, or those who have fallen out of treatment or care and they need to get back. And it's a real pivotal moment when I'm sitting there with someone who has just learned their diagnosis. And I'm able to actually come in, and even in that dark moment, I'm still able to shine a light and say, hey, you haven't learned about all this. This has been around for a long time, but just take your medication. You'll be fine. You'll be back to normal. Look at me. I've done it. And because of U equals U, I am able to actually see them smile before they walk out of that appointment. And it's so uplifting. And sometimes I have to try not to fall over and cry. It's a powerful thing to see. Now, I had a chance to sit in at some different agencies and see different staff and sit at their tables a little bit. And I remember sitting at this one place and the discussion of U equals U came up. And now this is a staff meeting we're talking about. We're not talking about a agency or community meeting. I remember hearing some of the negative things that the staff members had to say. a lot of them, per that incident, were not going to share it. I'm not going to tell my people that until they do a little bit more work or research. I'm not going to share it. And I remember sitting in there feeling so defeated.
I think, oh, I don't think, I know a lot of us know why. And Murray even puts it here Brian even puts it here in the chat, and he says they don't want STIs to rise. And that's a lot of reasons why they won't share it as well. But he says STIs have always been on the rise. Also, the behavior of condomless sex is a behavior that has always existed and will continue. So a lot of them are afraid because of these reasons here. They're afraid that people are going to go have condomless sex, and that the STIs will rise. But just what he just said, it's always been. So we have to continue to just keep sharing.
Right.
We talked about mentally, people get so used to the same thing, they don't know how to change it. It's just like us changing the language of HIV. It took me a minute to change the language. I had to keep repeating certain things over and over again. And it's the same as U equals U. We have to continue to tell ourselves that this is for real. How can you not believe in the science? So we have to continue to tell ourselves that. And eventually it'll click. It will click with some, eventually. Brian says we reflect on the Denver principles. They say we have a right to healthy sex, to a healthy sex life, and U equals U has brought the Denver principles full circle from 1983 till now. Yeah, you're right. You're absolutely right, Brian. Thank you. Now, the other question I want to talk about, because I know I keep jumping from question to question, but I want to talk about how can women fight harder, Dr. Blackstock, to be put in clinical trials, because we are still being left out. Are you able to answer that?
Yeah, sure. I think I know there's been a substantial amount of advocacy on part of so many groups that represent. We're talking about in particular, I think, cisgender women, or I guess even people who can become pregnant, for instance, or breastfeed. For almost all clinical trials are excluded, just in general. But in particular for cisgender women, when it comes to HIV treatment trials, I know that there are a number of advocates as well as researchers who are really pushing for really greater representation, because we do know that these medications can have different effects based on who is taking them, and so we need to be able to, if we're going to tell our patients that this medication is safe and it's been tested or studied in different populations, we need to actually see that happening in reality. So I think continuing to really advocate to speak out about the need to include women in HIV clinical trials is incredibly important, and it's really important also for all women, but especially, there are many women, we look at the epidemic even in sub-Saharan Africa, we're seeing adolescents, 75% of adolescents with HIV are girls, and then over 50% of adults are women, are girls. So, a lot of times what happens, I think, is, many of these trials are really driven, by pharma, for profit. And the concern is probably that they're not going to be making a substantial profit if they're marketing it towards women who make up most of the epidemic in other parts of the world. Whereas, here in the United States is a bit different. So I think continuing to have the voices of women is really important. This actually happened. So dolutegravir, there was concern about it causing neural tube defects when it was taken at the time of conception or right before conception. And there was a point in time where, many different normative bodies that do recommendations for HIV treatment said that, removed dolutegravir, said, big black box warning, don't use it for fear that's going to cause these side effects in unborn children. But the reality was they never checked in with women. There was no discussion with, what are, what's important to you? What are your preferences? For maybe some women, it was more important to have their HIV controlled and to stay healthy versus this very minimal risk. And, having people really understand that. And so since there's more data has come out showing that actually the risk of neural tube defects for dolutegravir is actually is very small, the absolute risk. They've also convened community advisory boards with women who can help inform in the future these recommendations about different HIV treatment. So the issues is that we often don't have the voices of women and other marginalized groups, when it comes time for clinical trials, for recruitment, and for engagement, and that really needs to change.
Yeah, it really does. Bruce says, yes, the field needs to elevate and recognize women with and affected. Absolutely, absolutely. Also here, he says, people need to hear it from the top down as well as from their peers. It is important to share this information. It is not enough to know U equals U. We have to share it. We don't have the leadership yet in the U.S. That we see in dozens of other countries to urge people to share it and to provide guidance on how to do it. We'll have it. We'll have the leadership in 2021. Of course we will. Of course we will. Reggie, so there in Indiana, what do you think can change, or the help that you need to change? You and Carrie, what are you guys doing there? And have you seen any outcome in the change of the advocacy that you guys are working on together there?
Yes, and I say that with a joyous heart and a joyous yes. It takes, I guess, you have to go day by day, but I am seeing some turnaround. I know here in Indiana, I think we are actually getting ready to really push U equals U. Okay. And from the last few things I heard at the statewide meetings, we are also going to focus, I believe, more on Black women, which I was excited to hear.
Right.
Because we never really pay attention to Black women.
Right.
I think we all kind of we're still on Black MSM. And that's super great, but I was excited to hear that we're going to shift a little bit and go and get our sisters.
Yeah, that's great. That's great.
But I have started seeing change, and I know we work a lot with helping change the policies and laws and things like that. Dr. Carrie she's a fighter. She does not give up.
Amazing.
Even when she keeps going. So as long as God gives her strength, I believe we are going to catapult into our helping those living with HIV.
Yeah, she's amazing. She really is amazing. I thought we were going to have questions. If anybody has any questions for Dr. Blackstock, I keep wanting to say Dr. Oni.
Just say Dr. Oni. It's totally fine. Say Dr. Oni. It's totally fine. What I wanted to also just quickly say to add on to what Reginald was saying was that, these HIV criminalization laws disproportionately impact Black people living with HIV. So it's not just it's a racial justice issue as well to get these HIV criminalization laws off the books. And then also just to say that, and I think all of you know this, but that, many of these laws, are not updated with the current science on HIV. Yes. And right. So really needing, it's, including especially U equals U, right? Yeah. And so it's such an imperative to make sure that so many of these various jurisdictions that have HIV criminalization laws, be aware of the updated science as well.
Right.
Yeah. If I could say.
Yes, go ahead.
I remember hearing here in Indiana that you could still do time for spitting on people.
Right.
And I remember sitting there like, oh my God, are we that behind or that uneducated? Like I learned that 5 minutes into HIV 101.
Right.
I couldn't believe that we were that far behind.
Yeah, there's still being people being charged for spitting.
Yeah.
We're working with the Center for HIV Law and Policy, myself and some other advocates, and Brian Jones that is on here for advocating for a man by the name of Nushan Williams. I'm sure you heard of him because you're in New York, who went to prison at the age of 19, 20 years old. He'd be 44 this month. He's not out yet. So we're working with them to help you get him out of there, because I always say, why is he the only one that's still gone after 23, 24 years? And he
Mm-hmm.
did his time that they gave him. He did
Yeah.
the time, the 12 years, and he's still not out. So, yeah, there's a lot. There's a lot that's put on Black folks. Definitely a lot. And Francesca says here, may I ask, when you say you are including Black women, you are inclusive of Black trans? Absolutely.
Yes.
Dr. Oni did talk about Black trans as well on the show in the beginning. So absolutely, Francesca, absolutely.
Yeah, and just to say, in New York City, when I was at the health department in 2018, we had a mass social marketing campaign around the city to promote PrEP for cis and trans women, particularly cis and trans Black and Latina women. So, we totally, get very, very much so that the Black trans and Latina women in particular, and Black trans women specifically, have a, shoulder and a really undue burden of HIV. And so, many of our efforts are focused on what we can do to support and uplift Black trans women.
Thank you. He also says, Brian says, the further compounds that, are these typos? The further compounds that, the further compounds that Black women are not being targeted when it comes to PrEP, right? They're not.
Mm-hmm.
And as far as PEP, Brian, I can't, because I think you have typos. I'm so sorry. Black folks are almost never offered or even educated. Yeah, well, I think he's talking about PrEP and PEP because it's not offered enough in women or in Black folks. That's what it seems like he's saying in clinics, which could be discouraging, or it could be the end of the 72-hour period. I'm not sure what he's saying.
No, I think he was saying something about PrEP not being targeted to. I think, I'm not sure if he specified cis or trans women, but this has been an issue, at least for Black cis women, in terms of PrEP. I think some of the challenges are, and this is the case also for same gender loving Black men and Latino men, that often individual behaviors don't predict or aren't associated with HIV risk, right? It's really about the social and contextual factors that people live in that then cause a high community prevalence or high level of HIV in the community. So like someone may not be having sex while they're intoxicated, they may not have multiple partners, but because their potential sex partners may not have access to healthcare for testing or whatever it is, they're more likely to be at risk for HIV. But so much of the recommendations for who should get PrEP is about behaviors, right? But we know that it's really about context, the social context, and what people are doing. And then the issue with PrEP, post-exposure prophylaxis, of people being referred to going to the emergency room and then being told to go to a clinic.
I've seen a situation like that where someone was in a panic. They didn't get it, first of all. They went to emergency for it, and they didn't. They told them that they had to wait till the next day to see a doctor at a clinic. They didn't have a doctor, to be honest with you. So they didn't get the PEP that they needed. They didn't get it. And I think that has to change. I also hear that a lot of the emergency rooms don't even know what PEP is. So they can't help you because they don't know what it is. And then PEP Black folks are never offered PEP when they go to emergency rooms, even if educated. A lot of them don't know about PEP either. That's what I've learned. I've learned a lot about that.
which is concerning just given how long it's been around, right? It's not something, you know, over the past decade that's a new development like PrEP. Like PEP, it's tried and true. It's been around for a while. But again, people, because of the way that healthcare is set up, you know, we don't really have a healthcare system. We have individual hospitals. People aren't communicating with each other. People don't have health insurance. People don't have access to something as basic as post-exposure prophylaxis when they need it. And again, as Brian was saying, this is something that's time sensitive, right? Like people need to get it within 36 to 72 hours or else it's not effective. And so when people aren't able to get it, that obviously increases someone's risk of acquiring HIV if they've been exposed.
Yeah, Bruce, I don't know why it's not being promoted more, PEP.
Sorry. Just like one more quick thing. You know, here I did see recently in New York City within the past year or two, I did see actually we have had campaigns where we have included PEP in the sort of toolkit, sexual health toolkit. And I did see one community-based organization have a specific PEP campaign, but Bruce is right. Like it's something that's definitely it's definitely neglected.
Well, you don't see it promoted much. Oh, no, it's the same as PrEP. You don't see PrEP promoted as much for women. You really don't. A lot of times when you're seeing the campaigns for PrEP, it's a group of men. So if I was a woman, I wouldn't know what it was for. I wouldn't know that it was for me. That's how I would see it. If it was me and I was a woman and I seen the campaign or a commercial, I would think that it was for men. It's not promoted enough. PrEP is not promoted enough for women either. So I don't have any more questions for you guys today. It's a really short show, but that's okay. I'm really happy that you guys came on. I appreciate it. I appreciate you guys only for agreeing to come on. And Reggie, yes?
Yep, there is one from Francesca. And
we don't hear PEP in many discussions. We are told more about You Equals You and PrEP have been the campaigns. I have never seen a campaign for PEP. Yeah,
go down a little bit more. She asked, she said, may I ask Reggie and the doctor, please forgive me for not knowing her name. How are you distinguishing MSMs from MSWTW, men having sex with trans women, when you're recording data?
Oh, okay, I see it. Well, I can't answer that. And I don't know if either one of you are able to answer that at all.
Yeah, this is, so data on men who have sex with trans women, that's like, again, a very under studied and, again, neglected area. And I think we often aren't collecting data that captures that nuance. But I do know there are a number of researchers and folks who are trying to get more of a sense of, like, you know, what are the issues, doing targeted messaging towards men who have sex with trans women, for instance, around PrEP and other prevention strategies. But yes, I agree. I think I don't know if most jurisdictions and most areas, are capturing data that specific about men who have sex with trans women. And I just saw. Go on, sorry, Reginald. Sorry.
Okay, so now, ironically, us here in Indiana, we actually are. In our testing, because I still do testing, we actually ask, have you had sex with men? Have you had sex with anyone who's transgender? And we do specify. So that, I think, we are starting to get right here, because we do have an organization called Gender Nexus who actually fights and advocates for trans women and trans men as well. And when they were going through the testing for Indiana, they noticed that it does not necessarily mention trans women. They kind of get thrown into with men, which was totally not fair. And it's totally inaccurate data. So when we are actually in our testing, we're distinguishing, have you had sex with men? Have you had sex with a trans woman?
Nice.
Yeah. Yeah, and it's possible, just to say, it's possible in New York City that we were doing this. I'm no longer at the health department, so I don't know the details, but I think it's so great to hear that in Indiana that level of detail is being collected. I wouldn't be surprised if in New York City it's happening too, but I don't know for sure.
Well, they're not too behind Reggie if they're doing that.
Yes.
That's right.
Yeah, that's great. That's great. Okay, you're welcome, Francesca. You're welcome.
And then Bruce had a question about whether there are also other jurisdictions that had PrEP campaigns for women. And the only other jurisdiction that I believe DC had something for PrEP for women. I could be wrong. So I don't know of many other jurisdictions that have had campaigns targeting cis and trans women. But I do also know that, community-based organizations that may have gotten funding, they often do their own campaigns. And I know, for instance, Voces Latinas, which is here in New York City, in Queens, is doing a PrEP campaign focused on Latina women who are meseras, who work in bars and restaurants, but also may have sex with clients, and doing a campaign targeted towards them. So while we may not see sort of large, citywide PrEP campaigns, I know that there are many community-based organizations that are working to spread the word among cis and trans women about PrEP.
Yeah. Right. Great. I don't think there's any more. I don't know how I didn't see a couple of those. And then replying to Francis, I love Murray says, you are right. DC has PrEP for cis and trans campaigns. Great. And then, well, if we have to think of this hard about it, then something is wrong.
It's true. It is totally true. No, it's totally true. And there's so many people who still don't, and so many women in particular who still have not heard of PrEP. But just to say that, the viewers may know that recently the results of a study, HPTN 084, came out, and that was looking at injectable PrEP compared to oral PrEP in cisgender women, and that showed that it was highly effective. And so we have data now for trans women, cisgender men, and cisgender women about injectable PrEP. So we might see in the next year, hopefully, FDA approval and people able to get not just oral PrEP as an option, but injectable PrEP. And that's an injection every 8 weeks.
Oh, that's great.
Yeah, it's huge. Mm-hmm. It could be a huge game changer, because the thing is, people want options, right? Like, if you're just like, we just have a pill for you, people who don't like pills are going to be like, I don't want to take a pill. But if you can say, now we have a pill and an injectable, that gets more people on board potentially.
Yeah, I think you're right. And yeah, Aisha Scott says, wow. Yeah, I didn't even know that. I had no clue. Let me see. I guess that's it. We're going to close, you guys. Do you have any more questions for Dr. Oni or Reggie for today? Sorry the show is so short.
Right. So Brian is just quickly saying, Brian is saying that access is a problem, right? So again, if folks don't have insurance that is going to cover PrEP, if they're not in a state that has a PrEP assistance program, if they don't qualify for it, again, this is the issue when we don't have like universal healthcare for everyone, is that we can have these technologies, but if people can't get access to it, it doesn't help.
You know what, Murray? That is so true. We see more campaigns focusing on PrEP instead of viral suppression. I've said this, Dr. Oni. I was going through some websites, and a lot of websites, it seems that everybody has a PrEP, like a link on their website for PrEP, for people who are negative. But they have nothing for people who are living with or who have HIV, mm-hmm. As far as prevention. So I say this: you have prevention for people who are negative to help them so they cannot contract HIV from someone who is HIV positive. But then when you go on their sites, the only thing that they have for people living with HIV is to get into care, and see your doctor. They tell them to stay on their meds. They might give them it might be a paragraph of HIV 101, but they say nothing about viral suppression. To talk about U equals U, to let a person living with HIV who just happened to go on the site because they needed some help living with HIV, but there's nothing there talking to them about viral suppression. I always say that we're fighting to tell people to get on PrEP, but those people that are getting on PrEP are negative. They're not transmitting HIV. So how do you help the people who are living with HIV, who are out of care? You help them to get back into care. And then the people who are living with and are in care, you talk to them more. Well, talk to everybody more about being virally suppressed. And we don't see that much. We don't see that much.
If I could, I'm not trying to get your show banned or shut down, but I think it has a lot to do with stigma and money.
Well,
I think
has to do with money, Reggie.
I agree.
I think people are, these agencies and funders or whatever they are, I think they're afraid that if we focus on suppression and ending the HIV epidemic, then what's there left to do after it's done? And I think that's the part that they're scared about. I think if they don't focus on that, then they can keep the money flowing in and keep things running as the way as it is.
Yeah, and I would also just say that attention to PrEP in particular, I mean, now we see, when Truvada first came out, I guess it took a few years for there to be direct-to-consumer marketing. It was it was on dating apps, and then it slowly expanded. When Descovy just got approved in October of, this past year, it went straight to advertisements. And actually, if you go to the Descovy page, the Truvada page for PrEP, it takes you right to the Descovy page. But just to say, there's a much wider, potential audience for PrEP, right, for prevention. And so, we're going to see, and a much smaller one for viral load suppression, right, in terms of the number of people potentially at risk. So I think again, also, like, these pharmaceutical companies, they can make a lot of money off of getting a lot of folks, on PrEP, right? And they're really, and that may also be driving, like, what we see advertising around PrEP, but we don't see advertising as much from pharmaceutical companies about getting a viral load suppressed.
Well, I've said that it's the same as people with HIV who were being pushed to take Truvada. Now it's just switched around. It's just switched around. People living with HIV was being pushed to take Truvada. Now it's switched the other way around. We're now negative to take Truvada. So it just keeps, the money just keeps rolling through. And they talk about PrEP because they're getting money for it. And that's why they're making campaigns. They're not getting any money to talk about U equals U. So they make a campaign about it, and spend their money doing it. That's just how I feel about it. Now, Claire says, as we elevate Black women in U equals U, let us include breastfeeding for women living with HIV and criminalization of Black women living with HIV in the U.S. Only white women living with HIV breastfeed, and no SPS is behind them. I always hear fear. I always have fear to do something wrong and see my children taken away. Are you saying to breastfeed, Claire? That's why you wouldn't breastfeed? And then she says there's not enough talk about U equals U in terms of sexuality. Sex brings kids. Another important aspect of U equals U is having a healthy life. Now I feel strong and healthy because of you. And then Brian talks about the market. They won't really say Truvada for PrEP. They imply Truvada is PrEP. So many on dating sites who are living with HIV choose to say, I'm in PrEP, not as PrEP, but to treat their HIV. I'm on PrEP. Okay, I see what you're saying. They won't clarify or say that PrEP is Truvada. For what reason? And then many marketing campaigns employ models that portray an unrealistic view of HIV with HIV, living with HIV. Many times we see same gender living couples in marketing versus single individuals, and the difficulty of social life, include dating, making friends, and etc. HIV is not a walk in the park. I cannot even imagine. I only hear about how difficult it is when you are living. Okay, I'm not sure what that says. This is a very healthy discussion. I don't know what that is down there in the last, by the last paragraph. When you say, I only hear about how difficult it is when you are a
person of color.
Oh, thank you. Living with HIV. Thank you. Thank you. Yeah, we can have many conversations, and this show could go on for 2 or 3 hours. It's been like this before. Um, we'll have another one. We'll have another one, and we'll have more discussions on these. I'm going to write all these questions down for you guys next time and have some other guests on to discuss this with everybody. I think that's it. There's nothing else there. And a person of color, I apologize. That's okay, Francesca. Okay, everybody, thank you, Dr. Oni, for coming on. Thank you, Reginald or Reggie. And we'll have more discussions like this. I'm not sure what the show will be about next week, but I'm pretty sure we're going to have 4 Black women on who are living with HIV to talk about Black women living with HIV and issues that we face and that we still face, trauma-informed care and so forth. So we'll have that on the 28th of November. Again, you guys, thank you so much for being on. Is there any last words that either one of you want to give, Dr. Oni, Reggie, before we go off of here?
Yeah, sure. Yeah, I think so much is going on with COVID-19, and I think and that what's going on could potentially impacts to the progress we're making to end the epidemic. But I'm just like so heartened and encouraged by so many community-based organizations, advocates really continuing to keep HIV at the forefront. And I think this attention with the ending the epidemic plan for America, which is infusing some more funding into areas that already have a high burden of new HIV diagnoses, will help. But I think we need to just continue to keep the pressure on. Like, there's so much more attention, particularly around racial equity, that we need to see in our federal response, our national response to ending the HIV epidemic. But I'm always so excited when I hear about the work of like what Reginald is doing, what you're doing, Dee, and what so many of the folks in the chat are doing to advocate for people living with HIV and people affected.
Thank you. Thank you, Dr. Oni. Reggie?
So I ditto to everything Dr. Oni did just said. Also, thank you, Dee, for on. I met you at AIDS Watch, and I remember like, oh my gosh, she's somebody to watch. And I think we were like on the same flight home. And I have followed your show, and I'm just so amazed at this platform that you have built to give people like me a voice and our community a chance to come on and learn and grow, and with love. So thank you so much for that.
Thank you, you guys.
Yes, thank you.
Thank you. Thank you. Okay, you guys, I have to talk about these few things here. If you're looking for HIV criminalization laws in your state, you can go to the Center for HIV Law and Policy.org. HIVlawpolicy.org. Put in your city, zip, or state, and you can find out about your HIV criminalization laws in your state. If you're looking for an awesome women's organization, blogs, articles, anything that has to do with women living with HIV, you can go to thewellproject.org. Thewellproject.org. I want to talk about a beautiful organization called Positively You Inc. Positively You Inc. is a nonprofit community-based organization created and led by minority minority citizens, activists, and staff with my majority of the individuals at this organization living with HIV in Florida. You can go to positivelyu.org and check that out. Positivelyu.org. Also, you have to remember, U equals you, everybody. Undetectable equals untransmittable. A person with HIV who stays adherent to their medication can no longer transmit. As long as they stay on their medication, they become virally suppressed, which means undetectable, which means U equals you, which means zero risk. Go to uequalsyou.org, uequalsyou.org, uequalsyou.org. Okay, everybody, this is Positively Dee discussion. You have to remember that HIV still exists. You have to get tested. You have to use protection. And if you have contracted HIV, you can get on medication and you can live a better, healthier life. I had a book that I was supposed to give away today. I was supposed to give this away today. The Straw That Broke. And it's by Tassinette. When I go into the show, I'll check and see who shared. And then next week, I'll put those names in my ticket drum. And I'll call off who won. I won't do it today. So share this live, and I'll put the names in a ticket drum, call it off next week, and send you this great book. I bought one. Actually bought two, and I'm giving this one away on the show. I haven't read mine yet, but I will, and I know it's going to be a good book. This is her second or third book, I believe. So share the show, and I'll put your name in the ticket drum for next week. Everybody have an awesome and amazing Saturday, and happy day.